Hello, my name is Corey White, and I'll be presenting on maternal mortality and race in the United States case study. So, what exactly is the public health issue? Black women are currently 3 to 4 times more likely to die from their pregnancy or childbirth compared to white women. They are also more likely to experience a preventable death during their pregnancy. So, what is causing these deaths? Certain issues are prevalent in African Americans, like diabetes and high blood pressure. These two diseases can cause issues in pregnancies, including cardiomyopathy, pulmonary embolism, hemorrhage, and hypertensive disorders. Also, what's causing these deaths is that there is the income difference. There's also an education status difference. Some women do or do not have insurance. There's also unconscious bias among medical professionals. And some women have access to maternity leave and some do not. So let's take a look at the social ecological model. At the individual level, some women are able to advocate for themselves at the doctor's office. They're able to tell the doctor what exactly is wrong or what is going on during their pregnancy. What hinders at the individual level is that some teenage girls have huge misunderstandings of the importance of regular checkups. As a result, they do not get seen by a physician as much as they should. And that also some women have tried giving birth at home, and when it's become unsuccessful, they're rushed to the hospital, which can cause certain issues with their pregnancy and increase the risk factors of maternal mortality. At the interpersonal level, certain families' feelings and knowledge about pregnancies helps women during their pregnancy by making sure they get seen by a physician or doctor. Some things prevent it, like family traditions that control the uses of maternal health services. Some family traditions do not like going to the doctors. As a result, they do not promote to the women to go to the doctor. At the organizational level, community health providers like Planned Parenthood truly help at this level. They help refer women out to certain OBGYNs that might be helpful during their pregnancy and help take care of them. What hinders at this level is that certain organizations don't take women without insurance. Um, some black women are living under the poverty line, and some, because of that, do not have insurance or not able to afford it. As a result, if they won't be able to go to certain places, they won't be able to get access to care due to the lack of insurance and organizations not being able to take them. At the community level, there are certain initiatives like the Alliance for Innovation on Maternal Health that help women connect with peers through peer-to-peer support groups that help get women together to support each other and help them through their pregnancies together. Additionally, at this level, that hinders it is that certain cultures and spiritual beliefs do not believe in healthcare intervention. So as a result, they do not seek going to the doctors in their culture. At the policy level, the Pregnancy Demonstration Discrimination Act truly helps at this level. It helps prevent any discrimination towards pregnant women. At this level, hinders at the policy level is that only about 30% of black mothers are eligible or have access to the Federal Family and Medical Leave Act. The Federal Family Medical Leave Act helps give women maternity leave during or after their pregnancy, which is very needed to make sure that they are safe and that their newborn child is safe. But only 30% of black mothers have access to this, so it's not being used for everyone, even though it is a great act. So, as my role as the public health nurse for this case study, I want to look at how we can reduce some of the risk factors of certain things. So, for starters, gestational hypertension. For this intervention, it includes a moderate level anaerobic exercise programs to help prevent gestational hypertension during the second trimester. Certain barriers and challenges are in place for this intervention, including that there might be lack of qualified personal trainers to help lead the exercise programs. There might be lack of transportations to the program. There also might be funding issues that help supply needed equipment, space, and salary of the employees. So, how exactly can we overcome these challenges? We can have the workout videos put online or given out to the women personally. This can help the women who are unable to get to the program by just being able to do it out of the comfort of their own home. Additionally, if a certain area does not have personal trainers, the women are able to get together in a group and do the training together at home as well. For the next intervention, it attacks gestational diabetes. This intervention is a lifestyle intervention during the first and second trimester that includes supervised education, exercise classes, diet education, exercise education, and diet activity. Certain barriers also affect this intervention, including lack of qualified personal trainers and nutritionists to help lead the exercise programs and diet education. There might be lack of transportation to the program, and additionally, there might be potential funding issues. So, how exactly can we overcome these challenges? Same thing as the last intervention, we can have the workout videos or the education material posted online or given out to women personally. This can help the women who are unable to get to the program as well. For the final intervention, this one is called Take Control of Your Pregnancy, Avoid or Early Elective Delivery. This intervention was made up by the Midwest Business Group on Health, and they set out to raise awareness of the importance of women reaching a full term birth by implementing an online resource and campaign. Another risk factor of maternal mortality is preterm labor. This can affect both the newborn and the mother. So that's why preventing women from having to do a early elective delivery can be very beneficial to both mother and child. Certain barriers are also affecting this program, including that since this program will be online, some women might have lack of access to computers or electronics or internet. So, to overcome this challenge, we can mail out these resources and education materials to the women personally. This way, they're able to get everything they needed without having to go online. So, how will we evaluate these programs to make sure that they are fully functional and beneficial to women? Each will go through a before after study. For the hypertension one, we'll be studying the risk factors for hypertension and their blood pressure before and after the intervention. Then be comparing the results to see if the program was successful in preventing gestational hypertension. There will also be a control group of women who are not a part of the intervention to see if the program is truly beneficial. Um, for the second intervention, it will for the gestational diabetes, we'll study the risk for gestational diabetes and their blood sugar before and after the intervention, then compare the results, and then also compare them to the control group of women who are not a part of the intervention as well. Lastly, for the last intervention, this intervention can be used for women directly, for their family members, or their employers. We will be evaluating how beneficial this is for the employers. So we will study different workplaces that have pregnant women working to see what exactly they have put in place for safe practices for pregnant women. After the intervention, I will check back immediately after the intervention and then a year later to see if they implemented new programs or new practices that were mentioned in the intervention and then see if they stuck with them for at least a year. Lastly, this is my logic model that goes over the inputs, activities, outputs, short term, intermediate term, and long term outcomes and the impact of them. So, some outcomes that we would hope to see short term outcomes is reduction in pregnant women's risk for diabetes, hypertension, and their blood sugar and blood pressure from the beginning to the end of the program. We're hoping to see that some employees, including the pregnant women, are following the business's new practices. For the intermediate term outcomes, we're hoping to see that the programs helped introduce new lifestyle changes, um, and that also pregnant women from those businesses are reaching those 39 weeks gestation for their pregnancy. And then for long-term outcomes, we're hoping to see a reduction in the rate of pregnant women having diabetic issues and hypertensive issues during their pregnancy within the first year. Additionally, we would want to see a year or two after the intervention is done that businesses are still having those practices in place and are being followed by every single employee in the business. Lastly, here are my references that I used for this presentation. Thank you so much for listening.